everyone, and welcome to this anesthesia training session where I will be talking about induction agents. So induction agents are incredibly useful and interesting. Obviously, I am biased in that regard, but they provide control over consciousness, and it's really unique because you can kind of rapidly come out of those effects depending on what drug and what dose you select. So what I will talk about is a little bit about how they work. I will go through some of the drugs that we use most commonly in our hospitals. There are certainly other induction drugs available on the market, but they may not be available in the United States, so I'm just gonna skip those for today. I will talk about some of the most important things you need to remember when picking an induction agent and also when you are giving that agent. And then I will go through each of the individual drugs, kind of talk about their formulation, maybe some of their dose ranges, some of their really interesting properties, and maybe some of the things you should be most aware about when giving that particular drug. So, induction agents. Induction agents, they are used for inducing general anesthesia. So we have to take an animal from a pre-medication phase to anesthesia. We have injectable sedation drugs. We have inhalant anesthetic drugs, but we kind of need the bridge between the two. And this is where induction drugs come in handy. So it goes pre-medication, induction, general anesthesia, recovery, regular life. So that's kind of how it goes. So when do we use induction agents in pets? So I talked about this earlier, inducing anesthesia makes a tremendous amount of sense, right? Short IV procedures where we might need just a little bit more than IM or IV sedation alone. So I'm talking about things like pericardiocentesis, perhaps cat unblocking, certain things that it is going to require maybe just a little bit more than sedation, but just one step down from full-on inhalant general anesthesia. So we do this all the time. Maintaining anesthesia. So you can provide anesthesia with gas, but you can also keep animals anesthetized with injectable induction drugs. So that's kind of cool, right? So there are certain times where I do use this, and it is mostly because of the properties that that particular drug provides. For example, I will do Propofol CRIs for animals that I am doing bronchoscopy anesthesia or brain MRI anesthesia. And I will talk a little bit more specifically about the brain stuff later on. Induction agents are also very useful for controlling aggressive dogs and cats. So there are certain induction agents that are acceptable to give IM instead of IV. You could also give them IV. But they can be used in order to provide anesthesia, and that's really nice because no matter how much alpha-2 agonist, acepromazine, full mu agonist, or benzos that you give animals, you will never overcome the ceiling effect of sedation to get them to the level where they're not going to move. The only thing that can guarantee motionlessness is anesthetic agents, not sedatives. And this is a very common complaint. People will say it's not sedate enough, it keeps moving. Well, animals that are sedate move. The only way you can guarantee them being free of motion is general anesthesia. So if you need that, you should just anesthetize them. So controlling aggressive animals, especially IM, I'm really talking about drugs like Alfaxalone and drugs like Ketamine. So what are some things we have to do when we're planning to induce general anesthesia, or things that we're going to do when we're planning on using induction drugs? If you are giving these drugs IV, you need to have a patent IV catheter. The reason why I say this is because some of these drugs, when they're outside of the blood vessel, they can cause tissue necrosis. Such a bummer. Do not want that. The other thing is that if you are reversibly depressing the brain and the spinal cord and causing animals to slow down their breathing, you need a way to provide other drugs, and you need a way to provide more drug in case maybe you don't have enough anesthesia, like they're not deep enough, or they wake up. So you need to have a patent IV catheter. Now, that being said, if you're sedating them IM, that's one thing. Sedate them IM, place the catheter. But if you are providing anesthesia, you should have a catheter. Permission for anesthesia. This kind of goes without saying. If you are giving an animal Alfaxalone, if you are giving an animal Propofol, if you are giving an animal Ketamine, IV or IM, you need to have permission for general anesthesia, because in the case that this is not a short IV sedation, or in the case that the animal becomes unconscious, stops breathing, and needs to be intubated, you need to be covered legally. So you need to make sure that someone does this. Code status. I mean, you should know this every time you sedate or anesthetize a patient, just so that you're prepared and you're not surprised. Especially for drugs like Propofol or Alfaxalone, these are some things that you really need to be aware of. So when you give animals Propofol IV or Alfaxalone IV, the whole point is that you're causing a reversible slowdown of the brain and the spinal cord. One of the things that the brain and the spinal cord control is breathing and enabling the animal to get rid of CO2 and get oxygen to their tissues. So when you give these drugs, they cause hypoventilation on room air. So hypoventilation has to do with CO2. So what that means is that the CO2 in the arterial blood, PaCO2, goes up. And if PaCO2 goes up on room air, your PaO2, your oxygen, goes down. So this is really important to remember, because when your PaO2 goes down, your pulse ox goes down. So if you give animals Propofol or Alfaxalone and they're breathing room air, they will desaturate every single time. And this is really important, because if you are doing this, you need to be prepared to give that animal oxygen. That means you have flow by, you have an anesthesia machine, you have a circuit, you have a mask, you have endotracheal tubes in case they decide to stop breathing and need to be supplementally ventilated. So this is incredibly important. So even when you're giving Alfaxalone to remove a catheter, even when you're giving Alfaxalone as part of a sedative, if you're giving an animal a little bit of Propofol to try and get a short IV procedure done, you need to be prepared to give oxygen, you need to be prepared to be intubated. Otherwise, if you get in a situation where you weren't prepared for those things, and let's say the animal did pass away, that is not going to hold up well in court. So make sure you protect yourself and your patient. Okay, the last thing I want to talk about when it relates to like what do I have to do is, when you give induction drug, you're giving it in a catheter for them to fall asleep when it's not IM sedation. So that drug needs to travel all the way from the IV catheter up to the right side of the heart, across to the left side, and up to the brain. So that stuff doesn't happen instantaneously. Depending on the animal's cardiac output, their heart rate, their stroke volume, it's going to take time for that drug to get to the brain. So when you give these drugs, allow one injection site circulation time, 30 to 60 seconds before giving more. And this is just so that you don't overdose the animal and you are giving the lowest effective dose of the drug that is necessary to achieve your goal. Number one, going to save money, which is always nice. Number two, why would you give an animal more drug than it needs? Number three, you might be able to spare the blood pressure and some of the cardiorespiratory depressant effects of those drugs. So usually how I do this clinically, let's say I pull up 4 mg per kg of Propofol for an anesthesia. If the animal's pretty awake, I will give it 2 mg per kg. I'll give it 30 to 40 seconds, kind of see what I get. And if the animal's ready to be intubated, that's great. Because I think when you'll find when you start doing this, giving them more time, that you're able to intubate animals on much less Propofol than you think. So think about that. Okay, so we talked about some of the common indications and the things you need to absolutely do beforehand. Now I want to go through some of the individual drugs that I use on a daily basis and what are some reasons why we might choose them. So the first one I want to talk about is our good friend Propofol. Propofol is by far one of the most common induction agents used in people and in animals, and after we go through the reasons, it would be a little easy to see why. So Propofol, I usually dose this at 2 to 4 mg per kg IV. Now, the amount of Propofol that the animal needs is going to depend on their level of sympathetic nervous system stimulation, like how awake are they, how excitable, what types of pre-medications did they get, How sick are they? I mean, every animal is going to be different. There are some you give 1 mg per kg, they're ready to be intubated. There are some where you need to give 4 or 5, and that is just the way that it is. So Propofol, in terms of its formulation, Propofol is a lipid emulsion. So it is an egg, oil, and soybean phospholipid emulsion. So if it has all those things in there, oil, fat, egg, phospholipid, it is a great supporter of bacterial growth. So generally, I would not keep bottles of Propofol open for more than 24 hours, but ideally, you would not use a bottle after 6 hours of opening. So when you crack a vial, you should date it, you should initial it, and put a time on it. That way, we're not giving gross Propofol to animals. Another thing to remember is that, we save a lot of unused Propofol for euthanasias, and over time, the drug turns yellow. It can absolutely still be used, but what I will say is that as the drug sits around, it has a decreased amount of active component. So sometimes you end up giving, let's say you have like a 60-kilo dog and you're using Propofol for part of your euthanasia, you might end up giving a syringe or 2 and you're saying to yourself, wow, this really isn't working. In that case, I would recommend going and getting maybe some newer syringes, or just making sure you have plenty on board to have yourself covered. Propofol, when you give it IV, it usually causes apnea. It also decreases, if it doesn't cause apnea totally, it will cause a decrease in respiratory rate and tidal volume, or basically the amount of volume that the animal moves in a small, quiet breath. And this makes sense, right? Because when you're inducing anesthesia, you want them to stop breathing so that the larynx stops moving so you can intubate them and then get them on gas. That's also kind of a bummer, right? Because if they're apneic, they're not breathing, they're not taking gas on board, and also if you don't have oxygen, they will desaturate. So those are things you need to make sure that you are covered for. That is one of the reasons why I give oxygen to every animal that I am anesthetizing, unless the animal is so vicious it will not let me touch it, because Propofol will make them desaturate, and some of these agents will make them desaturate on Ramirelone. So oxygen, very important. Cool property about Propofol, other than makes them unconscious, it decreases brain oxygen requirement, and it maintains brain blood flow better than inhalant anesthesia. So when you put an animal on ISO or SIVO, it ablates, or it gets rid of, brain blood flow autoregulation. The brain is one of these really cool organs that regulates its own blood flow, but when you put them on inhalant anesthesia, a lot of those properties go away totally. But Propofol preserves that. So that is one of the reasons when I am doing brain MRI or I am doing craniotomies that I really like putting those animals on Propofol anesthesia series instead of inhalant anesthesia. Can I tell the difference on a day-to-day basis? Not necessarily. It's very difficult to quantify how much oxygen the brain used that day. But if you have a situation where you're worried about brain tissues getting perfused, like there's a tumor, there's been a brain incident, a trauma, I think the best practice would be to try to use a Propofol series. So that's why I do that. Propofol can cause breakage or hemolysis of cat red blood cells and sometimes also dog red blood cells. So a lot of people say that Propofol is not safe to give to cats, or it's not safe to give for repeated administrations, and there are 2 reasons behind this. The first is one that I just talked about. Cat blood cells are very fragile. They are very susceptible to oxidation and breakage. So it has been shown that Propofol does cause some breakage of cat red blood cells, but in the studies where we examined repeated Propofol administration on cats, yes, all of the cats had some degree of red blood cell breakage, but none of the cats got significant anemia, and the results of that drug being given to those cats was not clinically significant. So you have my go-ahead to give Propofol to cats repeatedly. Like with every animal, be judicious about your dosing, but you're not going to kill a cat because of that particular reason. The other reason is that cats are relatively poor at something called liver glucuronidation, and a lot of these drugs are metabolized through the liver. Now, that being said, if you are giving a small dose, 1 to 2 mg per kg at a time, to effect to induce anesthesia, you are unlikely to have any untoward effect from decreased drug liver metabolism. So my standpoint is it is 100% okay to give propofol to cats, and it is not necessarily more dangerous than any other drug. Honestly, the most dangerous thing is the apnea. Okay, and I like to call propofol kind of the steady Eddie of the induction drugs. Not only is it very cheap, not only is it very reliable, but it provides a really good quality induction. Animals will usually close their eyes, they'll usually drop their head on the table, and then they'll sit down in lateral recumbency. So it provides like a very steady, reliable induction recovery process. So that's the deal with propofol. I'm going to move on to Alfaxalone. Alfaxalone I usually dose at 2 to 4 mg per kg, IV or IM. Alfaxalone is a drug that I think a lot of people have different understanding of, but I will talk about some of its specific properties and why I use it and why you might not use it. So, a lot of people say that Alfaxalone is safer than propofol. This is not really true. So the reason why people get caught up with that is because Alfaxalone has this really cool property. Alfaxalone does not blunt reflex tachycardia, which is elicited by the baroreceptors in the heart, in response to bolus dosing. So what does all of that garbage mean? So let's say you have 2 dogs. You give one of them 6 mg per kg of propofol really fast. The other one, you give 6 mg per kg of Alfaxalone really fast. The propofol dog is going to get bradycardic, and it's going to stay bradycardic for a while because propofol blunts the heart's corrective response to bradycardia. Now, Alfaxalone does not do that. So if you give an animal a large bolus of Alfaxalone, they'll get bradycardic, and then the heart will correct the response and jack up the heart rate again. So this is kind of nice, right? You know, there's a property of the heart that Alfaxalone preserves. Now, that being said, you are always giving induction drugs slowly. You are almost always giving induction drug with oxygen. You are waiting 1 injection site circulation time between giving a bolus and giving the next bolus. And you're going to give the lowest dose effective. So to me personally, on a day-to-day basis when I am monitoring animals getting propofol or Alfaxalone, I don't clinically notice a difference so much in the heart rate because I am usually giving very, very small doses of each. And I am using them in conjunction with alpha-2s, ace-promazine, benzodiazepines, dissociative anesthetics. So it's not necessarily safer, but it does have a really cool preservative function in it. Alfaxalone you can give IM. So that's really great because if you have an aggressive old cat that you want to sedate and you don't want to give it an alpha-2 or you don't want to give it ketamine, Alfaxalone would be a great choice. It's also a great choice IM for old little dogs with heart disease. Now, the volume of Alfaxalone you have to give is usually quite large. It's usually somewhere between 0.5 ml and 2.5 ml. It's kind of a big injection, so I would not recommend using Alfaxalone IM sedation for big dogs. So really dogs that are greater than 10 kilos, it becomes quite challenging. I tend to find that compared to propofol, Alfaxalone tends to cause a poorer quality induction and recovery process. And what I mean by this is that sometimes they will alligator roll, they will have myoclonus or muscle twitching. Sometimes it's little, it's very focal, centered around like the ear twitch or the eyelids. A lot of people will mistake that for the animal being awake and blinking, but when you look at them, it's not elicited by direct stimulation. So that would be myoclonus. Myoclonus usually gets worse the more drug you give, and some animals just have it more than others. So that's important to remember. It usually does go away within 60 minutes after the drug is given. If it doesn't go away and it's extremely bothersome, if you have access to mechanical ventilation and monitoring, you can always paralyze the animal, but that comes with its own set of complications. The other thing that works really well, other than waiting out, is a 0.5 mg per kg of ketamine will get rid of it. But I would generally just say, wait it out. Just wait for that to go away. It will be fine. There's no need to necessarily give it ketamine or paralysis. Okay, ketamine, one of my favorite drugs. So ketamine is another induction agent. Propofol and alfaxalone both work at the GABA receptor. We talked about this in the benzodiazepine lecture. It just has a slightly different binding site on the receptor. They cause hyperpolarization of chloride channels, which will induce this inhibitory effect on the central nervous system and cause anesthesia. Ketamine works a little differently. So ketamine is an analgesic drug. It is also a dissociative anesthetic, and ketamine works at the N-methyl D-aspartate NMDA receptor as an antagonist. Ketamine provides a couple of really interesting properties which make it pretty different from alfaxalone, propofol, and the other common induction drugs. So ketamine causes something called dissociative anesthesia. So what this means is that ketamine breaks apart or dissociates the prefrontal cortex from the limbic system. So the prefrontal cortex is the part of the brain which is involved in conscious thought, initiation of movement, and the limbic system controls behavior. So if you break apart those two parts of the brain, if you break apart that communication system, you're going to have control over the animal's behavior. And the really nice thing about ketamine is that you can give so much sedatives to animals, but you will never get them to stop moving, probably, fully, and you will never overcome that ceiling effect of sedatives. But the nice thing about ketamine is that because it is a dissociative anesthetic, you will be able to overcome that ceiling effect. So that is why ketamine can be very useful for restraint of animals that are difficult to sedate or that are super aggressive. So, dissociative anesthesia, and it produces something called catalepsy. So when we have animals that we give propofol to or alfaxalone, they close their eyes, they fall asleep, they go down like this. A cataleptic state is characterized by a couple of different things. So usually what will happen after one injection site circulation time is that the animal's eyes get very wide, the pupil will be very fixed, and usually the front limbs are almost in rigid extension in front of the animal. The quality of the muscle relaxation also tends to be quite poor with ketamine. This is why a lot of people will usually pair it with diazepam or midazolam to kind of soften that animal up. So it produces catalepsy. The other thing that ketamine does is that it really preserves the palpebral reflex and the laryngeal reflex. They have more tone down here. So if you give an animal an induction dose of ketamine, very often they will maintain their palpebral and some of their laryngeal tone. They might be just a little more difficult to intubate, but that is why you give them benzos. So they might not look asleep, but they are unconscious. They are just dissociatively anesthetized and they are in a state of catalepsy. So don't make the mistake that just because the eyes are open that it's not ready for you to get intubated. Just, open the dog or cat's mouth and try to get the tube in there. Ketamine is analgesic. That's really cool, right? So none of our other induction agents provide analgesia, but ketamine, even at a sub-anesthetic dose, provides modulation of chronic pain. And in people who get ketamine boluses at the time of surgery, they report having different pain scores and different qualities of life a year later. So even if you have a patient where you don't want to do like a big ketamine heavy protocol, even including a sub-anesthetic dose like 0.3 mg per kg can be really helpful. I use bigger doses for induction, so 0.3 mg per kg sub-anesthetic dose, 2 mg per kg Ketamine or ketamine propofol induction dose, 5 mg per kg cat-midaz dose. That's just the way I do it. Some people dose it differently. Now, when I give ketamine inductions to animals, I will always pair it with a muscle relaxant. So like 2 mg per kg of ketamine, 2 mg per kg of propofol, Ketamine, very common combination. Another thing you can do is 5 mg per kg of ketamine and a benzodiazepine. Some people give the benzo first and then the ketamine. Some give it the other way around. Some people combine them. All of them are fine. You can try any of those. Me personally, I combine them and give it as a fast bolus. I always keep around extra ketamine or extra propofol in case that big bolus was not enough. Because with propofol or Alfax, I give a little at a time and I usually have something left over. But in ketamine, I calculate a fixed dose and I give the whole thing. That's just the way I do things. So there are some other things about ketamine that you do need to be aware of. It is certainly not suitable for every animal, so I will talk a little bit about that now. So ketamine increases brain oxygen demand. It also increases heart oxygen demand. Ketamine stimulates the sympathetic nervous system. It is a sympathomimetic drug. That is what that means. Stimulates sympathetic nervous system. And what that means is that ketamine, when you give it, increases heart rate, increases blood pressure, increase oxygen demand of tissues. Now, in a healthy animal, that's not necessarily a bad thing. They can tolerate it. Here are some situations that I would not give ketamine to an animal. So, I do not personally give ketamine to old cats. The reason why I don't do this is because a lot of cats have hypertrophic cardiomyopathy. So if their heart is very thick and the walls of their ventricle are very thick, one of their problems is filling their heart. Your heart is filled during diastole, so during the resting phase of the cardiac cycle. Now, if ketamine increases the heart rate, the faster the rate, the lower the time for filling. So when you give ketamine to cats with HCM, the heart rate goes up and the blood pressure goes down. The other thing is that if ketamine increases heart oxygen demand, but you're not necessarily giving more oxygen, you're not necessarily delivering more oxygen to the heart, you might have arrhythmias, and that's a problem with some animals with heart disease. So I don't personally give ketamine to old cats. I would recommend using caution in that. The other thing is that I don't give ketamine to animals that might be in an oxygen deficient situation or in an impaired oxygen delivery situation. Just because if you increase oxygen demand without giving delivery, you might cause things like arrhythmias, you might cause impaired cell perfusion or cell death, impaired cell metabolism. So I don't do that, but everyone is different. There has been a lot of talk and research about if ketamine is safe for animals with brain disease or seizures. In the past, people have said that ketamine causes seizures or ketamine is epileptogenic. And what I can say based on the research is that ketamine is a drug which increases heart rate and blood pressure. If you have a brain tumor, you don't want to increase your blood pressure because the brain might herniate. So in those patients, it is not usually suitable, but there have also been many studies proving that ketamine does not necessarily increase cerebral blood flow. So the word is still out on that. Generally speaking, there has been a reason why people haven't been using ketamine in animals with brain disease. It doesn't cause seizures inherently, but you do need to be aware that it does have effects on cerebral blood flow and oxygen demand. So for those reasons, I would recommend using it judiciously, just like everything else. Okay, last victim, Etomidate. So Etomidate is a less common anesthetic drug. We do have it in both our hospitals. I do use it in select situations, and it's very helpful, but it is sometimes a challenging drug to use, and I will talk a little bit more about that now. So dose for Etomidate, 2 mg per kg. It's also a 2 mg per ml drug formulation, so it's usually the animal's weight in kilos is the amount of milliliters of drug that you would pull up. Etomidate is a really cool drug because unlike ketamine, which increases heart rate, and unlike Propofol or Alfaxalone, which might decrease the heart rate and then it gets sped up again or it stays down, Etomidate causes almost no change in contractility. It causes almost no change in heart rate and blood pressure. So for this reason, Etomidate is considered I'm going to put this in quotation marks, the cardiac safe induction drug. Now, there's no drug that's perfectly safe. It's really the technique and the selection that goes behind that drug. But we say that because Etomidate doesn't really change a lot of the heart function. So for animals with the worst of the worst cardiac disease, this would be a great choice to induce them. And especially, I like to use this in animals with low heart rate disorders. So for pacemakers, for really profound cases of vagal tone, very slow heart rates to start with, I think Etomidate is an excellent choice. Okay, but there are a couple of things you do need to know. So the osmolarity of plasma, so the amount of osmotically active particles in the plasma is around 378, 380 milliosmoles per liter. Etomidate is incredibly hyperosmolar compared to plasma. So it has all of these active osmotic particles in it. It's 4,700 or 4,780 milliosmoles per liter. So if you have a lot of osmotically active particles over here and not very many over here, it can induce some type of cell damage, and usually what we see from this is hemolysis. So I usually like to dilute this drug 1-to-1 with saline and give it to effect just like my other drugs. And I will usually have some propofol on hand in case I don't want to end up giving too much Etomidate, after I induce the very unstable patient. I would say, compared to other drugs, Etomidate is a poor quality inductor. It usually results in tyolism, so they salivate a lot. Their eyes become very fixed. They have a wide expression. They have myoclonus. They sometimes alligator roll. The first time I gave Etomidate to a Pomeranian with patenductus arteriosus, it alligator rolled and started salivating so much that we couldn't grab the dog's tongue for 25 seconds. So that made things a little challenging for intubation, but the animal was fine. To smooth out the quality of induction, I would highly recommend using a benzodiazepine because it will get rid of some of those undesirable effects. So, in summary, we have several agents available for use. They come in a variety of different doses, and depending on the drug you pick, you're going to get different effects on oxygen delivery and demand, different effects on muscle relaxation, and some of these you can even give IM, like Alfax and Ketamine. Some of them are safer for animals with certain heart diseases, and some of them are not suitable for certain populations of older animals. So when you pick these drugs, just be really deliberate in your choice and be able to stand behind it. And that's it.